Hey, you guys, as promised, we are doing our final SOAP note for the series of this month. So I will still break down the acronym, but then we'll work through applying it to one of our practice questions from yesterday so you can see it on the diabetic topic, okay? So let's get into it. So you know, or you should have learned from the series this month, a SOAP note, we utilize this to assist with documentation, right? S stands for subjective, O for objective, A for assessment, and P for plan. Now, each one of these categories, has certain things we can put into those groups. So, under that subjective, it's what is the patient complaining about? So, what is their chief complaint? What are they stating is wrong? Objective is what are you observing? What do you see with your patient when you're doing your assessment? A is assessment, and I tell you guys that's just a summary to tie everything together from the subjective, objective, and what you have concluded here with your overall assessment. And then lastly, P is planning. So, what's the plan? How are you planning to treat, and what are your plans moving forward based off of everything that you have put together from the subject, objective, and your tied together assessment? Okay. So, subjective. So, on yesterday, we did a practice question and it stated Miss May is a 68-year-old female who presents to the office for annual follow up. Her A1C is 6.7%. Her fasting glucose is 144. And then it's asking for first line therapy in the question, right? So here, and I know it doesn't give us a lot of things to put in, but we work with what we have, and then I'll kind of go through adding tidbits and notes that you should think about with your patients, okay? So subjective. The patient denies any complaints because, of course, the question didn't have any particular complaints. Annual follow-up, and I like to put this stuff here. So like if I have a patient who is just coming for their standard follow-up and there aren't any complaints, I put that in there, and so then you'll see that in the blurb. And then I put that she's a 68-year-old female. If she has any past medical history or anything that you want to include that goes along with this, we would. And so that's where that scenario comes in with, Miss May is a 68-year-old female presenting today, for annual follow-up. If she had um, complaints of, since we're talking about diabetes, so say she had complaints of weakness, anxiousness, sweating, anything like that, I would put, Miss May is a 68-year-old female who presents today with complaints of, and that will be all of those complaints that are listed from the chief complaint, okay? Objective. Objective, again, is what we observe, what we see. So here, so vital signs can go here. But in this question, it told us that the fasting glucose was 144, the A1C was 6.7%. So I put those things here. So the assessment, remember, we utilize this to tie it all together, right? It's a summary of what we tied together, your differentials of what you're thinking, right? And so here we have two factors over the range of the criteria, the qualifying criteria for a type 2 diabetes diagnosis. Remembering those are that A1C greater than 6.5%. Yes, it has increased. I'm just talking about for board preparation, you guys. These videos are to prepare you for boards, but the guidelines have increased to 7% for practice purposes. But the qualifying criteria, thinking of boards, A1C greater than 6.5%, fasting glucose greater than 126 milligrams per deciliter, and then the plasma, the 2-hour plasma glucose being greater than 200 milligrams per deciliter, okay? So here they have two of those criteria already. The fasting glucose is 144, so it's greater than that 126, right? And the A1C is 6.7%, so it's greater than that 6.5. So here you can go ahead and classify it with that group, type 2 diabetes. I put those things that the only details that I had under there that helped me come to that conclusion. And you like to do that because, again, we're doing this. So if anybody was to come behind you, they should be able to pick up as if they were here on this exam day. And also as you go back, so when they come back to follow up, you know what happened, you know where they were at the previous visit, etc., right? And then lastly, it's the planning. So based off of everything, what do you plan? So of course, we want to go to think that, hey, lifestyle modification has been in place, but you want to discuss that again, making sure that they are limiting those carb intake, going over all of what that is, telling them to watch the sugary substances, limiting alcohol intake, limiting sodas, limiting those uh, pastas and breads and white rices and things of that nature. Um, Telling them, encouraging them to exercise at least 5 days a week for 30 minutes on each of those days. Initiating metformin, 500 milligrams PO, because remembering metformin, also known as glucophage, so either term that you may see, either name, I should say, you should see on boards, know that that's what they're talking about, but that's first line therapy. And that was the answer on the question, and having that patient to follow up in 3 months. But also, since we have initiated them at form and letting them know, hey, you may have some stomach upset with this medication, one most commonly being diarrhea. While you're taking this medication, don't stop it if you notice the diarrhea. I know it can seem problematic, but give it 2 weeks and it should resolve. If it does not resolve in 2 weeks, call the office, and then we can make arrangements for different therapy and stop this one. Also, remembering the things that you would need to do. Again, I do these based off of just our little quick blurb of practice questions to kind of let you apply everything we talked about for the week. But knowing that on assessment for our diabetic patients, you do want to do your monofilament test, testing their feet, checking in between their toes, making sure that they're following up with an eye doctor, ophthalmologist, check their visions, checking those labs, and staying on top of that and managing. So in those next 3 months, I would definitely get labs to kind of make sure things like their kidney function and everything are still operating as they should, because all of these areas can be affected with diabetes. So you want to continue to stay on top of these and manage appropriately, okay? Now, I like to always put it all together so you can see the clear picture. So this is just everything we discussed all in one, because when you are doing a SOAP note, the documentation comes all together into one sheet so that you can either go to each section that you're looking for. You can see the whole picture if you need to, but it breaks down and then it concludes into the full documentation, right? All right. Thank you guys as always for watching. Please be sure to like, comment, and subscribe. If there's something that you would like me to cover, please put it in the comment. If you have any questions and need me to go a little bit deeper into anything on this, put it in the comments. I'm happy to do so. Share with whomever you may think that may find this helpful. Also, some fun stuff. And thank y'all for bearing with me this week. My voice is doing better. But I know it is not as strong as usual. But anyway, upcoming things next month, as we start off our next series, I will be covering everything non-clinical. So each week we will be getting into non-clinical content. So don't tell me I never did anything for you. This is the thing that people often struggle with, and it's basically just terminology, and it's just a lot to do. So we're going to go into it. I'm going to do a little repetition, teach you some ways to retain it, and just go through all of the content. Also, tomorrow is the last day to take advantage of that early bird special for my upcoming 5-week course, the 5-week intensive for my family nurse practitioner and adult Gero review, starting October 2nd through November the 10th. And that saves you $100 if you utilize the coupon code, type in early bird 23. Tomorrow's the last day to save. So if you're looking for that, it's in the description. I will put the instructions there as well. But with all that being said, you guys, as always, meet me back here. Bye, y'all.